Oh, hello, ladies and gentlemen. Thank you so much for watching Imani Television. This is Health, Hygiene, and Wellness on another episode where we discuss about our health behaviors, our wellness, as well as our hygiene. So today in our program, we have Dr. Silas Wambulwa, who is going to demystify to us more about diabetes. And as we know, diabetes is a disease that has been with us for a long time. I've been looking at the statistics. Diabetes mortality rate for diabetes rose up by 3% from 2009 to the year 2019. So it means it's a disease that is here with us. So we are going to discuss more about it. We can get more insights and also educate ourselves about this disease. My name is Barasa Saenyi. Welcome to Hygiene, Health, Hygiene and Wellness. Karibu sana daktari.
Thank you so much.
How are you today?
I'm fine. A chilly morning, but
yes.
Thank God for the rains.
Yeah, that's true.
Okay.
Speaking about diabetes, what can we say is diabetes?
First of all, thank you for inviting me to studio once again.
Yes.
It's always my pleasure to educate our population on matters concerning chronic diseases.
Yes.
Because that's my area of specialty. And I really appreciate those who find time to watch these very important sessions. Because as I've mentioned in the previous sessions, chronic diseases are very silent diseases, like the disease we are going to talk about today, diabetes. It's a very silent disease. We call it a silent killer because it's a disease that is very silent. By the time it gives you symptoms, it's almost killing you. We can say that. So that's why we are always having a pleasure to educate our people to know about these silent diseases, because there are those diseases that shout, but they rarely kill. That is malaria and other infectious diseases. You know, when you have malaria, you'll always have symptoms.
Yeah, they shout through their signs and
yes,
symptoms.
and you'll go to the hospital. But when you have diabetes, the symptoms will come later on. So what we always encourage our people who are watching today is they need to go for screening, which you've made very much available, as we'll be discussing in the topics today.
Yes.
We've made it very available and very cheap. So diabetes per se is a disease that is, maybe I can say, it's a chronic disease that is characterized by very high blood sugars in your blood. In the medical language, we call it hyperglycemia. So hyperglycemia means hyper is high, then glycemia means the sugars are high in blood. So whenever somebody eats food, we expect your sugars to go up. For example, if you go to the marketplace and buy a bottle of soda, which has almost 15 spoons of sugar, compared to your tea, which you take every day, that has maybe 3 spoons of sugar.
Yes.
Coca-Cola has, even all types of soda, even the Coca-Cola, Fanta, it has around 15 spoons of sugar. So when you take that soda, obviously your blood sugar will go up. You can imagine if somebody took 15 spoons of sugar and put it in your tea. Obviously, even you won't become...
That's excess, yes.
So once you take it, it goes to your blood after digestion. So after digestion, when it goes to your blood, there is always a hormone that is released. We call it insulin.
Insulin, yes.
That brings down your sugars. So for people who have diabetes, they have two things. Either they have less insulin, or maybe they have enough insulin, but the body is resistant to insulin. So that is for type 2 diabetes. I'll mention the difference between type 2 diabetes and type 1 diabetes. For type 1 diabetes, these are children who are born completely without insulin. So they have insulin for some few years, then there is something that happens in their life, which I'll explain later, that makes their body not to produce insulin. So that is how diabetes comes in. And it's a silent disease because it's progressive. Over time, you know, this resistance is not something you just wake up today and you have insulin resistance. There are some factors that will accumulate over time for you to have resistance. Then also for insulin, reduce insufficiency insulin, reduce production of insulin. Again, you can't just wake up one day and you have insufficient insulin. It happens over time. So that is diabetes, characterized by excess blood sugar or abnormal blood sugar in your blood. Yeah.
Now, if we talk about that is high blood sugar in your blood.
Yes.
What about low levels of sugar?
Yeah, low levels of sugar, I can say, is not a disease. It's a complication. It's just a complication of a certain disease. It can be a complication of diabetes itself. For people who are taking drugs, they take drugs in excess to an extent that their blood sugars go beyond the lowest levels. But other conditions that can cause hypoglycemia include any other diseases. You know, there are diseases that make people not to eat. You will go to a hospital, somebody has not eaten for 4 days. They'll develop low blood sugar. There are people who have anemia. They'll develop low blood sugar. There are people also taking some other drugs, like steroids and other drugs. They'll develop low blood sugar. Vomiting. If you keep on vomiting the whole day, in the evening, if somebody checks your blood sugars, it will be low. Fasting. There are people who do fasting, like the Muslims, the Christians, you know. It causes low blood sugar sometimes, which is not necessarily a disease, and it can be cured by you just going to eat. So low blood sugar, I know there is that myth and misconception where I've heard, you know, I work in the diabetes clinic. People say that sukari yangu ni ya kushuka, sukari yangu ni ya kupanda. I've heard people mentioning that. No, that they know there are no types of diabetes like that where we have low blood sugar and high blood sugar. No, low blood sugar is a complication of diabetes. It's the one, diabetes is one of the complications, the most serious complications of diabetes. And it comes because at times you have not controlled your sugars very well, or you are not going for your clinics to get the necessary health education that can make you prevent low blood sugar. So I know people talk out there and say, you know, I have diabetes, ile ya chini, the low blood sugar. My diabetes is the one that always comes down. My diabetes is the one that always goes up. No. It's just a complication. If you find people talking about that, there are people who have not been exposed to health education on diabetes.
Now, Doc, there are this type, we say there is type A or type B diabetes.
Yes.
How can you explain them, and how can you differentiate between the two?
Actually, the correct word is type 1.
Type 1.
Type 1 diabetes and type 2 diabetes. In the old days, they used to call it insulin-dependent diabetes and non-insulin dependent. But we realized that, and this is what I need people to understand, we realized that everybody who has diabetes at one stage in their life, especially if you live with diabetes for more than 5 years, you might need insulin injections. You know, there are people who feel like, those who are type 2, they feel like they should not be put on insulin. The old people, somebody who is 50 years, 60 years, when a doctor tells them, I want to put you on insulin, they say, no, that one is not good. That one is for the very sick. But at one point, you might need insulin. And I'll explain that. So, type 1 diabetes. Type 1 diabetes affects the young people. And young people in the medical field, we mean those who are below 35 years. So, anyone from the age of birth, like currently, the youngest child we have in our clinic here is around 3 years old. So diabetes can affect somebody from day one of their life up to 100 years. So those who are below 35 years, some cases might have type 1 diabetes. And if somebody develops type 1 diabetes, you should not ever maybe blame them for their lifestyle. It is not their lifestyle that causes type 1 diabetes. Not like type 2. Mostly type 1 diabetes is autoimmune. You know what the body does? The body just starts eating up the cells in the pancreas. And it eats up, we call them the beta cells. It eats up the beta cells that are supposed to produce insulin until to a point whereby the body can no longer produce insulin. So when the body can no longer produce insulin, if somebody takes food, this food is converted to sugar, but there is nothing that can carry the sugar from the blood to the cells, which we call insulin. You know, the body has eaten up. And it's just autoimmune. So these children are just born with diabetes. Whether they take sugar, some parents have been coming to us that, you know, my child has never even taken sugar, but he developed diabetes. It's not sugar. It's all about the body just causing some problem on its own. So for type 2 diabetes is now the most common, because most people who suffer diabetes are type 2. The type 1 diabetes is less common. Just a few children are affected. You might find in the one family. Just going back to type 1 diabetes, it does not most occasionally run in families. A child might just come up and develop diabetes. If you ask whether the parents had diabetes, there's no one who had diabetes, because as I've said, it is something like genetics. The genetics of this child exposes them to diabetes.
Yes.
So not necessarily that somebody had diabetes, but at times you will find that a grandfather or maybe the father of this child had diabetes. So it can also run in families.
Yes.
For type 2 diabetes is strictly for those who are above 35 years, but also the young can get diabetes, what we call MODY, maturity onset diabetes of the young, but not very common. And again, also these children who are below 35 years, we've seen parents who have maybe let their children gain what we call obesity. So if you have a child who is 20 years and is obese, they can develop diabetes, but if they develop diabetes, their diabetes is type 2. Because their diabetes is coming because of obesity, not because of the genetics. So that's why parents need to take care of their children's weight, because they might develop diabetes. So I'm not saying type 1 diabetes is just for the young people only, also for the old people only. Even the young people can develop diabetes, but mostly this diabetes of the type 2 diabetes, the characteristics is a bit different. It takes time to show you the symptoms. You realize somebody might live with diabetes for even 5 years, and yet
they don't realize
they don't realize they have diabetes. It will affect mostly the old people from around 40 years, 45, 50, at the prime age of your life when you need to provide for your family. That is the time when you develop type 2 diabetes. And when you develop type 2 diabetes, it is characterized by very high sugars. And maybe you might start losing weight at one point, or maybe you might not even lose weight. You're just okay. The signs and symptoms might come later on, like excessive urination. We'll look at them later. We'll start having lethargy, getting tired all the time. So that's type 2 diabetes. And mostly it comes because of the risk factors, which are obesity, excessive consumption of sugary things, which you consumed in your 20s. You know, people get employed at around 24 years, 25 years. Then they start taking a lot of sugar, others start taking alcohol and other things. So what you are eating at 25 years might cause diabetes at 50 years, 40 years. What you are eating in 30s might cause diabetes in a later age. So it depends with the life that you are living. So that is type 2 diabetes.
And is there any difference physically between the signs and symptoms for type 1 and type 2?
Yeah, you know, these children who get diabetes, you will notice that this one is type 1. They are very slim. They have lost weight.
They are
when
slim,
they
but
come
they are
to the
diabetic.
hospital, they are very sick. That is type 1. Most of the time, you cannot live with type 1 for so long because you don't have insulin in your body. Insulin is a very important thing. If you lack insulin, you might lose life. So these children, once they lose insulin completely, you know, there is a threshold. So when this mark goes below the threshold mark, it means this child can no longer survive. The body starts demanding that you get insulin. And by then, if you put them on insulin, by the following month, they're up, they've gained weight, they are just okay, the symptoms have gone off, they are well. But for type 2 diabetes, this person is just stable. In fact, when we tell them we are admitting you because your sugar is 30, they refuse because they're telling you, we are not sick. I just came because I was urinating a lot or I was sweating a lot. Why are you putting me in the ward? But they are sick, but the body does not tell them the symptoms. So that is the difference between type 1 and type 2. Type 1 cannot be missed, although some parents still miss it because they take their children to be treated for malaria, to be treated for TB, to be treated for UTIs because they are urinating a lot. They punish their children that, you know, they have started their bad behaviors. That's why they are urinating a lot. And, you know, it's
they
just
think maybe it's
an STI.
STI, yes.
That's what I mean. And yet it is diabetes, because even the girls who have type 1 diabetes, they come with very strong discharges from their intimate areas. So, you know, those symptoms might be there, but you have to go to the right person. What I usually tell people, if you realize you are urinating a lot, you are losing weight, apart from the HIV test, go for a diabetes test, because diabetes makes you lose weight even more than HIV. You can lose 10% of your weight in a month's time if you have diabetes. So just go and check for diabetes. Simple. If you get it, we treat you, you gain your 10% of weight, you go back to your normal function. So those are the symptom differences in type 1 and type 2.
Having known the symptom differences, which are these signs or symptoms that are common between the first one and the second one?
Thank you. Now the symptoms are the same, so I can't separate. So you'll allow me to just mention all of them, because the symptoms for diabetes are just the same. Only that, as I've explained, there might be a difference in the disease pronunciation in these people who have type 1 diabetes and type 2. So the symptoms are, the cardinal symptoms are 3. Excessive urination, excessive thirst, excessive hunger. So you eat, but you don't get satisfied. You want to eat again. You sweat, and you sweat a lot. Even at night, there is just drenching night sweats. Then also, there is loss of weight. Sometimes people might start losing weight unexplained, especially for type 2 diabetes. It's very funny, because most of these people who have type 2 diabetes, most of them have been longing to lose weight because they are obese. Then all of a sudden, you've been longing to lose weight for 2 years. Then all of a sudden, you just start losing weight, and there is no intervention you've made. You've not been doing exercise, you've not been going to the gym.
You just lose weight.
You're just losing weight. My friend, come for a diabetes test, because you can't lose weight when you have not intended. That's what we mean. Now,
Doc, I would like us to talk about the urination. Is it frequent or huge amounts of urine?
It is very frequent. It's huge amounts of urine. So when we talk about increased frequency of urination, it's a lot of urine. You can even go 10 times to the toilet. At night you can wake up even 4 times. Unusual, and we don't mean it is excess. We just say unusual. There are people who take a lot of tea in the evening.
Yes.
They go to the toilet several times. But today, you are going, if you used to go 4 times, you are going 6 times. That means it's excess. And you'll notice that you are going more frequent than you used to do. Other symptoms, maybe just wind up on the symptoms, is, we have weight loss. We mentioned about weight loss. There is lack of energy. There is always the energy that somebody has. So these people might lack energy, and maybe they get tired easily when they do something. Then there is also the excessive breathing. Somebody has difficulties in breathing. There are also the signs and symptoms of malaria, where you feel like the joints are aching, you have a headache, you just feel like you have malaria. Most of the people come for treatment for malaria, and we test them, they have diabetes.
Now, Dr. before we take a short break, how do you test diabetes?
Testing diabetes is simple. It is a 5-minute thing. In fact, not 5 minutes, 2-minute thing. And you don't need to see a doctor before you go to check for diabetes. Just walk straight to the lab. Tell them, I want to check my blood sugar. You don't need to, people fear these queues in the hospital, and we don't want them. Just go straight to the lab. Tell the lab officer, I want to check my blood sugar. It costs 100 shillings in some private and some public hospitals. Some hospitals is free. So you need it, and you need to take your blood sugar test twice a year. Imagine. So it is simple, and the normal levels for your blood sugar will be from 4 to 7.
That's normal.
Yeah, whether you have eaten or not. It's supposed to be 4 to 7. Anything above 7, whether you have eaten or not, you should consult further to know if it is diabetes or not. So it should be 4 to 7. Anything above 7, whether you have eaten or not, you should consult further.
All right. Now, Dr. let us take a short break here on health, hygiene, and wellness. Then when we'll be back, we'll be discussing about how to cope with diabetes, what to avoid, and what to take, as well as the treatment for that. Money Television will be right back.